Good morning, everyone. I'm Dr. Amelia Rose, and today we're diving into something that's been generating a lot of excitement in both traditional medicine and modern clinical research: the role of two powerful spices, cinnamon and fenugreek, in managing blood sugar levels. Whether you're living with diabetes, prediabetes, or simply trying to maintain metabolic health, what I'm about to share could genuinely change how you look at your spice rack. So let's begin. Understanding blood sugar, the foundation. Before we can appreciate the impact of cinnamon and fenugreek, we need to have a rock-solid understanding of blood glucose regulation. Bear with me through this foundation because everything else I say today will build on it. What is blood sugar? Blood sugar, or blood glucose, refers to the concentration of glucose circulating in your bloodstream at any given moment. Glucose is the primary fuel source for your brain, muscles, and virtually every cell in your body. It's not the enemy. It is, in fact, essential to life. The problem arises when glucose levels are chronically too high, a condition we call hyperglycemia, or, in some cases, too low, hypoglycemia. Both extremes are dangerous, but for the purposes of today's discussion, we are focusing on the epidemic of elevated blood sugar and its consequences. Normal blood sugar ranges. A fasting blood glucose level, meaning you haven't eaten for at least 8 hours, should ideally fall between 70 and 99 milligrams per deciliter. Levels between 100 and 125 indicate prediabetes. Anything at or above 126 on 2 separate occasions is diagnostic of type 2 diabetes. Your HbA1c, glycated hemoglobin, tells us the average blood sugar level over approximately 3 months. A normal HbA1c is below 5.7%. Prediabetes falls between 5.7 and 6.4%. Diabetes is diagnosed at 6.5% or above. The insulin system. When you eat a meal, particularly one containing carbohydrates, your digestive system breaks those carbohydrates down into glucose. That glucose is absorbed through the walls of your small intestine into your bloodstream. Blood sugar rises. In response, your pancreas, specifically the beta cells in the islets of Langerhans, detects this rise and secretes insulin. Insulin is a peptide hormone. Its job is to act like a key. It binds to receptors on the surface of cells and unlocks them, allowing glucose to enter. Once inside the cells, glucose is either used immediately for energy or stored as glycogen in the liver and muscles, or converted to fat for longer-term storage. In a healthy individual, this process is elegant, precise, and self-regulating. What goes wrong in diabetes? In type 2 diabetes, which accounts for approximately 90 to 95% of all diabetes cases worldwide, one of two things happens, or often both simultaneously. First, cells become insulin resistant. The insulin receptors on cell surfaces stop responding properly to insulin. The key, so to speak, no longer fits the lock. The pancreas compensates by producing more insulin, a state called hyperinsulinemia, but over time, even that compensation fails. Second, the beta cells of the pancreas become exhausted or damaged from years of overproduction, and insulin secretion itself begins to decline. The result? Glucose stays in the bloodstream. It accumulates, and over months and years, that excess glucose causes catastrophic damage. It glycates proteins, essentially coating them in sugar, damaging blood vessel walls, kidney filtration units, the retina of the eye, and peripheral nerves. This is why uncontrolled diabetes leads to heart disease, kidney failure, blindness, and amputations. It is not a minor condition. It is a systemic whole-body disease driven by one central problem: too much glucose in the blood for too long. The scale of the problem. The International Diabetes Federation estimates that as of 2023, over 537 million adults worldwide live with diabetes. Another 541 million have prediabetes, a condition where blood sugar is elevated but not yet in the diabetic range, yet carries significant cardiovascular and metabolic risk. These numbers are staggering, and they are growing. This is why the search for safe, effective, accessible, and affordable tools to support blood sugar management is one of the most urgent areas of medical research today. Let us begin with cinnamon. Cinnamon has one of the longest and most storied histories of any spice in human civilization. It was prized in ancient Egypt, used in embalming rituals, and as a gift worthy of kings. It appears in the Hebrew Bible. Arab traders guarded its source jealously for centuries. It helped drive the age of exploration as European powers competed to control the spice trade routes. But beyond its cultural and culinary significance, cinnamon has been used medicinally for thousands of years in Chinese, Ayurvedic, and Greek medicine, primarily for digestive issues, respiratory conditions, and, interestingly, for what ancient healers described as excessive sweetness in the urine, their description of what we now know as diabetes. Modern science has spent the last several decades trying to understand whether these ancient intuitions had merit. The answer, it turns out, is a resounding and nuanced yes. Now let us turn to fenugreek, a plant that, in my clinical opinion, deserves far more attention than it typically receives in mainstream medicine. History and traditional use. Fenugreek, Trigonella phenum graecum, is an annual leguminous herb native to the Mediterranean region, the Middle East, and the Indian subcontinent. Its seeds have been used medicinally for at least 4,000 years. Ancient Egyptians used fenugreek seeds for embalming and as a remedy for fever and digestive complaints. In ancient Rome and Greece, it was used to treat respiratory and metabolic conditions. In Ayurvedic medicine, it has been prescribed for thousands of years for madhumeha, the Sanskrit term for what we now recognize as diabetes. In traditional North African, Middle Eastern, and South Asian cooking, fenugreek seeds are a common spice, used in curries, breads, and herbal preparations. This wide culinary use means that large populations have been naturally consuming fenugreek as part of their diet for millennia, providing a remarkable natural experiment in its safety and tolerability. The fenugreek plant grows to about 60 centimeters tall. Its seeds are small, hard, and amber-colored, with a distinctive, bitter, slightly maple-like flavor. The seeds, and to a lesser extent the leaves, are the primary medicinal parts of the plant. How fenugreek affects blood sugar. The mechanisms. Just as with cinnamon, fenugreek works through multiple, distinct mechanisms, and understanding them helps us appreciate why this herb is so versatile and effective. Mechanism 1. Slowing of gastric emptying and carbohydrate absorption. This is fenugreek's most immediate and well-documented blood sugar-lowering mechanism. The galactomannan fiber in fenugreek seeds absorbs water and swells into a thick, sticky gel that coats the walls of the stomach and small intestine. This viscous gel does two critical things. First, it slows gastric emptying, the rate at which food moves from the stomach into the small intestine. By slowing this process, it delays the delivery of glucose to the intestinal surface. Second, it forms a physical barrier that impedes the interaction between digestive enzymes and carbohydrate molecules and reduces the contact between glucose and the intestinal absorption surface. The resulting practical result is a flatter, more gradual rise in blood glucose after meals, what we call a reduced glycemic index effect. Rather than a sharp spike followed by a rapid crash, blood sugar rises slowly and smoothly, a much healthier pattern that reduces insulin demand and protects beta cell function. Mechanism 2. Direct insulinotropic effect via 4-hydroxyisoleucine. As I mentioned earlier, 4-hydroxyisoleucine has a unique and remarkable property. It directly stimulates insulin secretion from pancreatic beta cells, but only in the presence of elevated glucose. In laboratory studies, this compound has been shown to increase insulin secretion by approximately 170% at high glucose concentrations, but has minimal effect at normal or low glucose concentrations. This glucose-dependent mechanism is clinically very important. It means fenugreek can enhance insulin secretion when you need it, after a meal, when blood sugar is rising, but does not cause hypoglycemia when blood sugar is already at a safe level. Mechanism 3. Enhanced peripheral glucose utilization. Studies in animal models and some human trials suggest that fenugreek supplementation increases the activity of glucose transport proteins, particularly GLUT4, in skeletal muscle and adipose tissue. This enhances the peripheral uptake and utilization of glucose, reducing its concentration in the blood. Mechanism 4. Inhibition of key digestive enzymes. Like cinnamon, fenugreek has demonstrated inhibitory activity against alpha amylase and alpha glucosidase, the enzymes responsible for digesting carbohydrates into absorbable glucose. By inhibiting these enzymes, fenugreek slows carbohydrate digestion and reduces the magnitude of post-meal glucose spikes. Mechanism 5. Potential beta cell regeneration. This is an area of active and exciting research. Several animal studies have demonstrated that trigonelin, one of fenugreek's key alkaloids, can stimulate the regeneration of damaged or depleted beta cells in the pancreas. If this effect translates to humans, it would represent a fundamentally different and more profound therapeutic action than most diabetes medications, which manage blood sugar but do not address the underlying beta cell dysfunction. Human trials specifically examining beta cell regeneration are limited, but the preclinical evidence is compelling enough to warrant serious investigation. Mechanism 6. Anti-inflammatory and antioxidant actions. Fenugreek is rich in flavonoids, including quercetin and trigonelin, which have potent anti-inflammatory and antioxidant properties. As with cinnamon, these properties address the chronic low-grade inflammation that drives insulin resistance and accelerates diabetic complications. Mechanism 7. Effects on lipid metabolism. Fenugreek saponins, particularly diasgenin, have been shown to inhibit cholesterol absorption in the gut and to increase the excretion of bile acids. Since bile acids are made from cholesterol, their increased excretion pulls cholesterol out of circulation. The result is a reduction in total cholesterol, LDL cholesterol, and triglycerides, all of which are risk factors for the cardiovascular complications of diabetes. The synergy, cinnamon and fenugreek together. Now I want to address what I consider to be one of the most promising and underexplored areas in this field, the combination of cinnamon and fenugreek. You will recall that these plants work through partially overlapping but also distinctly different mechanisms. Let me map this out for you. Cinnamon primarily works by enhancing insulin receptor sensitivity, activating GLUT4 translocation, inhibiting PTP1B, reducing inflammation and oxidative stress, and slowing carbohydrate digestion through enzyme inhibition. Fenugreek primarily works by slowing gastric emptying through fiber viscosity, directly stimulating insulin secretion via 4-hydroxyisoleucine, improving peripheral glucose uptake, inhibiting digestive enzymes, potentially regenerating beta cells, and reducing lipid absorption. When you look at these mechanisms together, you see that they address multiple different points in the blood sugar regulation system simultaneously. Cinnamon targets the insulin signaling pathway at the cellular level, fenugreek targets glucose absorption at the intestinal level, and insulin secretion at the pancreatic level. This is what pharmacologists call a multi-target approach, and it is the same principle behind many of the most effective pharmaceutical diabetes regimens, which often combine drugs with different mechanisms for better overall glycemic control. A small number of combination studies have been conducted. One trial using a combination herbal preparation containing both cinnamon and fenugreek, among other botanicals, found superior glycemic outcomes compared to either alone. While large-scale, high-quality trials specifically on this combination are still needed, the mechanistic rationale for synergy is very strong. In my own clinical practice, I have observed that patients who incorporate both cinnamon and fenugreek, along with appropriate dietary and lifestyle modifications, often achieve better blood sugar control than those using only one or neither. Practical Guide: How to Use Cinnamon and Fenugreek. Dosage and Forms. The dose range studied in clinical trials is 1 to 6 grams of whole cinnamon powder per day. 1 teaspoon of ground cinnamon is approximately 2.5 to 3 grams per day, so half a teaspoon to 2 teaspoons per day falls within the therapeutic range. Ceylon versus Cassia. For daily supplementation, I strongly recommend Ceylon cinnamon due to its very low coumarin content. If you are only using cinnamon occasionally in cooking, Cassia is fine, but for consistent daily use, Ceylon is the safer choice. Forms available: ground powder, easily added to oatmeal, yogurt, smoothies, coffee, or tea. This is the most accessible and practical form for most people. Cinnamon sticks can be simmered in water to make cinnamon tea. 1 to 2 sticks per cup of water, simmered for 10 minutes. Standardized extract capsules, typically standardized to contain specific amounts of cinnamaldehyde or polyphenols. These are convenient and allow for precise dosing. Look for products standardized to at least 0.5% cinnamaldehyde. Aqueous extract. Water-soluble extract have been used in some clinical trials and may offer certain advantages in terms of bioavailability. Best time to take cinnamon. In evidence suggests that taking cinnamon with or just before meals may have the greatest impact on post-meal blood sugar spikes. Some practitioners recommend a consistent time each day for fasting glucose benefits. Fenugreek, dosage and forms. Clinical trials have used doses ranging from 1 to 100 grams per day, though the most practical and well-tolerated range is 5 to 15 grams of whole seeds or seed powder per day. A teaspoon is approximately 4 grams, so 2 to 4 teaspoons per day falls within the therapeutic range. Forms available: whole seeds, traditionally soaked in water overnight or in hot water for 15 to 20 minutes, then consumed in the morning. Soaking reduces the bitterness somewhat and may improve bioavailability. 10 grams, approximately 1 tablespoon, soaked in a glass of warm water overnight is a common traditional preparation. Seed powder can be added to smoothies, yogurt, bread, or incorporated into cooking. Many people mix fenugreek powder into warm water with a small amount of honey. Capsules. Standardized fenugreek extract capsules offer convenient, consistent dosing and minimize the bitter taste that some find unpleasant. Fenugreek tea. Simmering seeds in water for 10 to 15 minutes. Best time to take fenugreek. Consuming fenugreek seeds or powder 30 minutes before meals seems to maximize the fiber-mediated slowing of glucose absorption. Some protocols recommend taking it first thing in the morning on an empty stomach. Sample daily protocol. Morning. Soak 10 grams of fenugreek seeds in warm water overnight. Consume in the morning 30 minutes before breakfast. Alternatively, take 1 fenugreek extract capsule. With breakfast, half a teaspoon of Ceylon cinnamon powder stirred into oatmeal, yogurt, or morning tea. With lunch and dinner, half a teaspoon of cinnamon in food or beverages if targeting higher doses. Safety, side effects, and drug interactions. Dr. Amelia Rose: I would be remiss, deeply remiss, if I did not spend significant time on safety. These are powerful compounds. They must be used with intelligence and caution. Cinnamon, safety considerations. Coumarin toxicity. As I have emphasized, cassia cinnamon contains significant amounts of coumarin, which is hepatotoxic at high doses. The European Food Safety Authority has set a tolerable daily